Hello viewers, welcome to the other session of Postgraduate Diploma in Environmental and Occupational Health. I am Professor Rupani. Today we are going to discuss about another course that is MEVE 002, that is Healthcare sector. So in healthcare, today we are going to think about what are the chemical as well as the allergic hazards in the healthcare facilities. Previously we have studied about the chemical hazards, chemical toxicants, and then how to deal with it. Today especially these chemical hazards, those who are facing in the healthcare sectors, there are so many healthcare sectors, everyone was realized as well as experienced, especially in this COVID pandemic situation. There are doctors, nurses as well as the healthcare consultants like that. So, how they are also facing the chemical hazards in the healthcare setup, hospitals or otherwise nursing homes like that. So, we know that chemicals that pose both health as well as the physical hazards. So, the potential health effects that may result from the exposure to chemicals, that depends on so many factors. So, like properties of the specific chemical, like toxicity as well as the whether it is a gaseous form, whether it is in the physical form, and the dose and the concentration of particular chemical, or it is a combination of some other toxic chemicals, as well as the route of exposure, whether it is inhalation, whether it is an ingestion like that, and also how much time, that is a duration of the exposure, and also depends upon the person, that is the individual susceptibility. That means all chemicals will not harm equally to all people. So, that definitely depends upon the person to person, and also any other effects which are resulting from the mixtures with the other chemicals. So, in order to understand how chemical hazards that can affect a person, it is important to understand how the chemicals can get into our body and to do the damage. Today we are going to discuss only two main routes of entry of these particular toxic chemicals, especially in the healthcare sector. The first one is the inhalation and the second one is the absorption, maybe through the skin or by through the eyes. So, the main objective of today's discussion is the list as well as the describe the sources of chemical hazards like disinfectants, sterilants, anesthetics, hazardous drugs, and also the chemical waste in the healthcare sector especially, and also to explain the pathways of the exposure to chemicals to healthcare workers, and also to discuss the short term as well as the long term health effects of the chemical exposure. So, we will see the first one is the inhalation of chemicals, how it can be inhaled by absorption of chemical through the respiratory tract. Once it is inhaled, definitely it will go to the lungs only. So, once the chemicals have entered into the respiratory tract, the chemicals that can be absorbed into the bloodstream directly for the distribution throughout the body. So, these chemicals, those that can be inhaled in the form of vapors, fumes, sometimes mists or the aerosols, and also fine dust. So, how the respiratory tract encounter all these toxic chemicals? So, the respiratory tract is the only organ system with the vital functionalities and also in constant and direct contact with the general environment. So, the lungs, they also have the largest exposed surface area of the any organ on the surface area, that is 70 to 100 square meters versus 2 square meters for the skin and 10 square meters for the digestive system. Just imagine that, and also you have to think about it. So, the respiratory tract is divided into three regions. The first one is the nasopharyngeal, that is extends from the nose to the larynx, and these passages are lined with the ciliated epithelium and also mucous glands. So, they filter our large inhaled particles that increase the relative humidity of the inhaled air and also moderate its temperature. And the second part is the tracheobronchial, that is it consists of the trachea, bronchi and also bronchioles. What they will do? They will serve as the conducting airway between the nasopharyngeal region and also alveoli which are present in lungs. So, these passageways which are lined with the ciliated epithelium that is coated by the mucus that serves as an escalator to move particles from deep into the lungs back up to the oral cavity. So, they can be easily swallowed. A lot of mechanism we are not in general we never ever realized, and then we never ever noticed. So, these ciliated cells that can be temporarily paralyzed by smoking or using cough suppressants. And the third part is the pulmonary acinus, that is the basic functional unit in the lung and also the primary location of gas exchange. It normally consists of small bronchioles that is connected to the alveoli. So, the alveoli of there are 100 millions in humans that contact the pulmonary capillaries. So, once the inhaled particles this enters into the tract and they settles in the respiratory tract according to their diameter. 5 to 30 micron particles are deposited in the nasopharyngeal region, 1 to 5 micron particles which are deposited in the tracheobronchial region, and less than 1 micron particles which are deposited in the alveolar region by diffusion as well as the Brownian motion. So, in general most particles 5 to 10 microns which are in diameter, they are removed. But certain small inorganic particles that definitely settle into smaller regions of the lung and they kill these cells which attempt to remove them. So, the result is fibrous lesions of the lung and also the toxicants that can be classified according to how they affect the respiratory tract. So, these are the asphyxiants, that is the gases that deprive the body tissues of the oxygen. That means it will stop the supply of oxygen. And simple asphyxiants are the physiologically inert gases that at high concentrations they displace air that leading to suffocation. So, we will feel sometimes if we will inhale any noxious chemical, we will feel suffocating like nitrogen, helium, methane, neon or argon. So, chemical asphyxiants are also there. They are generally gases that prevent the tissue from getting enough oxygen, like carbon monoxide and cyanide, and of course, we know that carbon monoxide that binds to hemoglobin 200 times more readily than the oxygen. So, the cyanide prevents the transfer of oxygen from blood to tissues by inhibiting the necessary transfer enzymes. And the next one is the irritant. So, what type of chemicals that irritate us? Irritant the tract. So, the chemicals that irritate the air passages, the constriction of airways that may lead to the edema, that is a liquid in the lungs, and also infection like hydrogen fluoride and then chlorine and hydrogen chloride and ammonia with the combination. And other type of chemicals are the necrosis producers. So, these chemicals they will result in cell death as well as the edema like ozone and nitrogen dioxide. And another important disease is fibrosis producers. This is the fibrosis. So, what type of chemical it will create that one? That means chemicals that produce the fibrotic tissue, that is if massive blocks the airways and also diseases the lung capacity and decreases the lung capacity like silicates, asbestos as well as the beryllium. So, the workers, those who are working in that particular occupation, working with the silicon industry, silicate industry as well as the asbestos industry, they will suffer with this blockage of airways and that decrease the lung capacity. And other thing is the allergens. So, chemicals that induces an allergic response immediately, cough, sometimes cold or nose block, that is characterized by the bronchoconstriction as well as the pulmonary disease like isocyanates are there, sulfur dioxide. And another most important as well as scary thing is the carcinogens. The chemicals, that means the carcinogens that means cancer causing agents. The chemicals which are associated with the lung cancer, like cigarette smoke especially. So there are so much of, they are giving very instructions to the people to cigarette smoking is injurious to health. So because, and also coke, that is the oven emissions, asbestos as well as the arsenic. These are the commonly known compounds, chemical toxicants which can cause the carcinogenicity. Not only various chemicals affect the respiratory tract, but the tract is also a route for chemicals to reach other organs like solvents like benzene and tetrachloroethane, anesthetic gases, and also many other chemicals that can be absorbed through the respiratory tract and also causes the systemic effects. There are so many symptoms of exposure to chemicals through inhalation like eye, nose and throat irritation, coughing and difficulty in breathing, headache, dizziness, confusion and finally collapse. So in any of these symptoms are noted, so we have to leave that area immediately and get fresh air. So some chemicals can be absorbed by the skin that resulting in chemical exposure. So most situations of this type of exposure that results from the chemical spill or a splash to unprotected eyes or skin. So once it is absorbed by these organs, the chemicals can quickly find its way into the bloodstream and cause the further damage, in addition to the immediate effects that can occur to the eyes as well as the skin. So if we will think about the skin in terms of weight, the largest single organ of the body, it provides a barrier between the environment and also to the other organs except the lungs as well as eyes. So, and it is a defense against many chemicals. So the skin consists of epidermis, outer layer, that is normally we can call it as, and the dermis, that is the inner layer. So in the dermis, there are sweat glands are there and also other ducts are there, sebaceous glands are there and connective tissue, fat and hair follicles and blood vessels. So hair follicles and sweat glands, they will penetrate both the epidermis and dermis. Chemicals that can penetrate through the sweat glands, sebaceous glands or hair follicles. Although the follicles and glands that may permit a small amount of chemicals to enter almost immediately, and some part they will pass through the epidermis that constitutes the major surface area. So the top layer is the stratum corneum, a thin cohesive membrane of dead surface skin. This layer turns over every 2 weeks by complex process of cell dehydration and polymerization of intracellular materials. We never ever notice that. So the epidermis plays the critical role in skin permeability, and below the epidermis that lies the dermis, a collection of cells that providing a porous, watery and non-selective diffusion medium, and intact skin has a number of functions. That is, the epidermis, what it will do, it prevents the absorption of chemicals and is a physical barrier to the bacteria. Sebaceous glands that secretes fatty acids and also the bacteriostatic and also fungistatic. Melanocytes are there, that is a skin pigment that prevent damage from the ultraviolet radiation in sunlight. Sweat glands, they regulate heat. And next, the absorption, which is enhanced by the breaking the top layer of the skin by abrasion or sometimes cuts, and increasing hydration of skin, increasing temperature of skin, that causes the sweat cells to open up and secrete sweat. So definitely it can dissolve the solids or any of the chemical toxicants and increases the blood flow to the skin. So increasing in the concentration of the substance, increase in the contact time of the chemical which is present on the skin, and it increases the surface area of the affected skins, and there are so many functions, altering the skin's normal pH and also decreasing particle size of substances, adding agents that will damage the skin and also more susceptible to penetration. So adding surface active agents these are the other organic chemicals like DMSO for example, that can act as a carrier of the substances, that inducing ion movement by an electrical charge and absorption of toxic chemical through the skin that can lead to local effects, that through direct contact like and also irritation and necrosis and systemic effects. Many chemicals that can cause a reaction with the skin that resulting in inflammation called the dermatitis. So these chemicals which are divided into three categories, that is the primary irritants that acts directly on the normal skin at the site of contact if chemical is in sufficient quantity for the sufficient length of time. That means duration as well as the concentration is also more important. And skin irritants like acetone, benzyl chloride, carbon disulfide, chloroform and also chromic acid and also some other chromium compounds and ethylene oxide, hydrogen chloride, iodine, methyl ethyl ketone, mercury, phenol, phosgene, picric acid, toluene like this. And photosensitizers are also there. What are these? That means these increase in the sensitivity to light, that results in irritation and also the redness. So like tetracyclines, acridine and also the pyridine, furfural and also the naphtha. Some are allergic sensitizers are there. So there are repeated exposures of that particular compound like formaldehyde and phthalic anhydride, ammonia, mercury, nitrobenzene, toluene, diisocyanate and cobalt and also benzoyl peroxide. If we will look into the allergens, how they will affect the healthcare workers. So normally if we will observe that in any healthcare worker, they are encouraged to wear gloves by the World Health Organization, especially in this COVID pandemic, because there is a direct care of the patients in this COVID pandemic situation. So medical gloves, if you will look into the picture, medical gloves are made of different polymers like latex, nitrile rubber and polyvinyl chloride, polyurethane and also natural rubber latex and also neoprene. So many adverse skin reactions like irritant, contact dermatitis, allergic contact dermatitis and also the contact urticaria that have been reported with the use of all types of gloves. So if you will see the doctor's hands, in some doctors, those who are allergic to the gloves, they are using different types and then the duration of wearing those gloves are also reduced. If you will see that picture of that a doctor's hand, you will observe that how there is an allergic to that particular gloves. So healthcare workers are highly at risk of developing allergic reactions, and especially the operating room personals and dental assistants, laboratory personals, hospital housekeeping personnel and also ambulance attendants and these are prone to have the allergens for this type of chemical toxicants. So skin reactions, what they will do, that they are localized and also burning, stinging feeling, contact and generalized urticaria. So the most frequently observed reaction is the irritant contact dermatitis. So it is dry, crusted as well as fissuring, patches and plastic gloves are also there. They are also considered as the hypoallergenic polyvinyl chloride gloves. They are also used among the healthcare workers. So contact allergic reaction to PVC has also been reported as a result of allergy to many additives which are used in these gloves like carbamix and also the mercaptobenzothiazole MBT and also thiuram mix and mixed dialkyl thioureas and black rubber mix like that. So allergic contact dermatitis that has been reported in number of case reports and lesions that may also become generalized in some patients, a patch test has to be used to confirm the diagnosis especially. But the patient should be advised to use the other types of gloves. And what are the sources of the chemical hazards? So disinfectants, sterilants, anesthetics, hazardous drugs, surgical smoke and also the chemical waste especially. So, these 5 types of the sources are encountering by the healthcare workers. So, what is the route of exposure? So, we have seen that absorption by the chemical through the breathing or absorption of a chemical through skin. So, if we will look into the disinfectant as well as sterilants. So, sterilization that describes the process that destroys or eliminates all forms of the microbial life and also carried out in the healthcare facilities by physical or chemical methods. Steam under pressure, dry heat, and also the hydrogen peroxide gas, plasma and also liquid chemicals. These are the principal sterilizing agents used in the healthcare facilities. So, it intended to convey an absolute meaning. Unfortunately, some health professionals and technical and commercial disinfection as well as the sterilization items partially sterile. So, when chemicals are used to destroy all forms of microbial life, they can be called the chemical sterilant. And disinfection is also one of the process that eliminates many, or sometimes we can say that all pathogenic microorganisms except bacterial spores on inanimate objects. So, in healthcare settings, objects usually are disinfected by liquid chemicals or wet pasteurization. So, each of the various factors that affect the efficacy of the disinfection that can nullify or limit the efficacy of the process. So, formaldehyde, for example, I would like to take one or two examples. So, formaldehyde is used as a disinfectant as well as sterilant in both its liquid as well as the gaseous states. So, normally it is used principally as a water based solution called the formalin. There is a 37% of formaldehyde by weight. So, the aqueous solution is the bactericide and the tuberculoside, fungicide, virucide as well as the sporicide. So, because of the lot of uses as well as the advantages for this formaldehyde, so this is used very widely. And also it is a colorless and strong smelling flammable chemical that is produced industrially and also used in building materials like the particle board or plywood, and also the in addition especially in the healthcare, it is used as a fungicide, germicide as well as the disinfectant. And also most importantly, it is a preservative in mortuaries and medical laboratories. So, it occurs naturally in the environment also. So, it is produced during the decay of the plant material in the soil and during the normal chemical process in most living organisms. It is also a combustion product which is present in the tobacco smoke. So, how it will go? So, what it will do? It inactivates inhaled. It inactivates the microorganisms by alkylating the amino acid and sulfhydryl groups of that particular protein and also the ring nitrogen atoms of the purine bases. So, with different concentrations of these aqueous formaldehyde solutions, they destroy a wide range of microorganisms. And also other viruses, they are also inactivated with 2% formalin itself. Sometimes the 4% formaldehyde is tuberculocidal agent activating like that, and also in Salmonella typhi in 10 minutes. So, that is in the concentration of 10 to the power of 7 like that. So, people are exposed primarily by inhaling the formaldehyde gas or vapor from the air or by absorbing liquid that containing formaldehyde through the skin. So, they produce the workers, those who are produce the formaldehyde or the products that contain formaldehyde, they may expose to higher levels of formaldehyde than people in the general population. So, the formaldehyde vapors are absorbed by the lungs, and at very low concentrations in the air, this formaldehyde is detected by its peculiar smell. But persons sensitized to formaldehyde, they may feel headache and also irritation of eyes and also airways, and also the irritation in the mucous membrane including eyes. If you will see the glutaraldehyde as a disinfectant, it is also used to eliminate harmful microorganisms on surgical instruments. It can also get into the air from its use as a disinfectant, and employees and the patients that can expose to this chemical, so they may have the some adverse effects. So, it is used as a cold sterilant to disinfectant a variety of heat sensitive instruments like endoscopes, dialysis equipment, like that. So, normally the nasal as well as throat and lung irritation normally can happen with the exposure of this glutaraldehyde. And there are so many other disinfectants are also there, like orthophthalaldehyde, hydrogen peroxide, ethylene oxide, peracetic acid. These are also have the negative health effects. Anesthetic gases also there, like nitrous oxide, and halogenated anesthetics are there, like halothane and also enflurane, isoflurane and disflurane, sevoflurane, and also the methoxyfluranes. They belongs to the halogenated fluorocarbons, and they are mostly mixed with the nitrous oxide. So, during administration of the anesthesia, variable amounts of anesthetic gases leak from the patient's anesthetic breathing circuit that consisting of the face mask and also the endotracheal tube, machines, pumps, ventilator, like that. So, the leaked gas that definitely enters into the air of the operation theatre. So, this is known as the anesthetic waste. So, post operative exhalation of the patient's exhaled air also contains this type of gases, that is also important source for the air contamination. So, the staff, which are those who are working in the operation theatres, the nurses and also the anesthetists, surgeons, nurses, assistant staff, all are working in the patient recovery room. They have low dose but regular exposure to these anesthetic agents. They have short term exposure to high concentrations and sometimes exposure to high concentrations of these gases. They cause the headache, irritability, fatigue, nausea, drowsiness and difficulties with judgment and coordination and liver and kidney damages. So, there are some hormone agents are there, and antiviral agents are there, and also some bioengineered drugs are those who are working in the areas where these drugs are used by the exposed to these agents in the workplace. So, the hazardous drugs are also most important. If the workers that is especially, for example, I would like to take one example, that is the about 8 million US health workers are potentially exposed to these hazardous drugs, like pharmacy and nursing personnels, physicians, operating room personnels, and also the environmental service workers and workers in especially in the research laboratories or veterinary hospitals and also shipping and receiving personnels. So, there are so many workers, those who are working in these hazardous drugs sectors, they are also having the adverse effects. So, these hazardous drugs are the anti-neoplastic drugs, non-anti-neoplastic hazardous drugs, and also drugs with the reproductive effects. So, the exposure to these drugs that definitely have the adverse health effects in the healthcare workers, like acute or some are chronic, and also skin rashes, and also adverse reproductive outcomes, infertility, spontaneous abortions and congenital malformations, like that. So, the health risk that is depends upon how much exposure a worker has to these drugs and how toxic they are. So, workers can be protected from exposure to hazardous drugs through engineering and administrative controls and also the proper protective equipment. And surgical smoke is also there, the byproduct of the procedures that using the electrocautery and other heat producing devices that may pose serious risk on that one. And also one study to quantify the exposure that is on a single day in, or otherwise it is an equivalent of smoking up to 30 unfiltered cigarettes. Just imagine that. So, it is not just exposure to carcinogens that has providers as well as the health of that particular personnel. So, the biological substances which are also considered to be mutagenic and also possibly that is infectious like malignant cells and viruses, they have been detected in surgical smoke. So, it is estimated 90% of all endoscopic and surgical procedures that produce plume, and approximately 500,000 healthcare workers, they are exposed to laser as well as the electrosurgical smoke each year. So, with all these, I would like to conclude over here. In healthcare workers, the major source of chemical exposures are disinfectants, sterilants, anesthetics, hazardous drugs, surgical smoke, and chemicals which are used in the diagnostic procedures and laboratories and hazardous wastes. So, the critical areas of exposures are the sterilization rooms, operation theatres, and inhalation as well as the skin contact are the common routes of exposure. So, exposure through the inhalation, that results direct entry of the chemicals into bloodstream without passing through the detoxification process in liver as well as the liver, especially liver and kidneys. So, they can have the more harm. So, with these I would like to conclude this session. With the next session, we will come up with the other interested characteristic features of these, especially in the health sector people. Thank you.